start. Just let me know. You ready to go, Jay? All right, let's hit it. You will imagine the following scenario. During a service, you have sustained a minor cut to your index finger. The injury is such that you can continue with the service. Your work area or client has not been contaminated. You are expected to demonstrate the proper procedure for blood exposure. You will be expected to follow a client protection, safety, infection control procedures. You will have 10 minutes to complete this section. You will be informed when you have 5 minutes remaining. Step back to indicate that you are finished. We're going to repeat. You will imagine the following scenario. During a service, you have sustained a minor cut to your index finger.
Stop. So, you're going to use a pencil or a marker, okay? Cut your finger. Show them that you've cut your finger. You're going to dispose of that into your trash, okay? Or to be disinfected because it is an implement, okay?
All right. The injury is such that you continue with the service. Your work area or client has not been contaminated. You're expected to demonstrate the proper procedure for blood exposure.
Stop there. In the real world, you're going to probably clean up the area that you have this blood exposure situation. But this is you. You're the only person here, so you're going to cut yourself. Then you're going to stop the cut, okay? You're going to stop the service, but the instructions are you're going to be able to continue. So when you finish, you should look like Michael Jackson. One glove in your hand, all right? Okay. So, procedures, continue.
All right, you will be informed, you'll have 10 minutes to complete this section. You'll be informed when you have 5 minutes remaining. Step back to indicate that you are finished.
All right, so now you're going to go through your blood spill procedure. You have your first aid kit here. Okay, you can bring out the things that you need. You got a bag, then you have a second bag for your exposure. You cut yourself. You step away after you dispose of that implement. You wash your hands, okay? You can do it with some hand sanitizer to show them that you're washing your hands, okay? Show them that you're washing your hands. Once you wash your hands, you put on the glove, all right? Your glove here is going to be for protecting the cut area, okay? The area is cut. You have on your glove. Now you take some wet cotton round. You can use your antiseptic, okay? Apply pressure. Show them that you're applying pressure. Maybe 5 to 10 seconds or so, okay? You're applying your pressure. Now this goes into a plastic bag. You come now and you get a cotton round or a alcohol pad. Once again, this goes into cleaning the cut, cleaning the cut, cleaning the cut. Once you clean the cut, into your bag. You have your cut clean, you're in the bag. Now you get another cotton round. Your aseptic. You're going to place a little bit on your cotton round. You're going to use a Q-tip. And you're going to clot the cut. Use it to clot the cut. Q-tip, cotton round into your plastic bag. Now everything that you have that touched any type of bodily fluids, blood, you're going to have it in that plastic bag. You're going to take your Band-Aid. And you're going to apply to your cut area. The Band-Aid is applied. Now you're going to grab another glove, cover this cut area, using the fingertips base to remove this glove. Back up. Before that, expose your trash that was soiled into a double bag. Double bag it, and this can go into your trash, okay? Prior to removing the glove as such. In your bag, trash. Now you have the blood spill cut, clean, and removed.
5 minutes remaining.
5 minutes remaining. So now that you have, as the scenario said, you clean the cut and you can continue the service. All right? All right. You had a question?
Should you sanitize after you take that glove off?
No, because you gotta wash your hands.
All right. Then another thing,
Talk to me.
well, in the directions, they specify your index finger.
Okay.
Do you think they're hitting people when they go into the universal supplies with that same finger? Or should you know what I mean? Because if they thinking, okay, this finger's contaminated,
Right.
it's bleeding, then you going to grab stuff, then you contaminating everything in there. So keep that finger away.
Right.
That would
Can-
make
And we
sense.
can choose either hand, right? I can say that my left index finger is the one that was damaged because I am more dominant with my right, just so I don't have the tendency. Not trying to complicate it. It doesn't say which finger's cut.
Doesn't say.
Yeah.
So it's my left finger.
But it says index.
It does say index,
It says
yeah.
index. This is why you're going to go over this.
Yes.
Okay, over and over and over again, because as they're reading it, you should be mouthing this.
Yes.
Yes, you should know this, okay?
So
So,
when will we be able to see